Good morning. It's Jim Vanderwall at the Fraser Basin Council. Thanks everybody for joining us this morning for our webinar on building climate resilience at Island Health. We've got Ting Pan joining us today as our speaker, and we'll say a bit more about her in a few minutes to introduce her. For those of you that are new to our webinar series, hopefully you're able to see and hear. There's information on the bottom of the screen about how to access audio if you're using a phone line, or you can also listen through your computer speakers. So this webinar is part of our BC Regional Adaptation Collaborative Series. The purpose of this initiative is to support local governments and First Nations industries, as well as public sector organizations around considering future climate in their plans and decisions. And so we put on webinars like these, workshops. We also have the Retooling for Climate Change website, where you can look for resources on different sectors and different topics. There's a snapshot of what it looks like. We also have recordings of our past webinars for people to check out if they're not able to make it, or to review materials, and also materials from past workshops as well. We're pleased to have support from the federal government through NRCan, the Adaptation platform, as well as the provincial government and the Ministry of Climate Change Environment and Climate Change Strategy. We just wanted to let you know about a few upcoming events. One is a webinar on getting to know the guides and toolkits for sustainable land and water use planning. That's coming up on March 13th, and there is a handout attached to, you can see in your control panel. You should be able to download information on that and the link to register. 2 days after that, on the 15th, there's also a webinar on learning from the Fort McMurray Wildland Interface Fire. And there's a link in the chat where you can register for that webinar. Both very different but interesting topics. And as well, there is a handout for anybody that might be joining us from Northeast BC. There's a public talk happening on March the 5th. Trevor Murdoch, who many of you may know, who is with the Pacific Climate Impacts Consortium, will be up there for some work that we're doing with communities in the Northeast. So we're taking advantage of that to have a public talk on March the 5th. So you can also access information about that event in the handouts. So as you can probably see, we're keeping the audio muted as we usually do, so that we can hear our speaker. You'll have an opportunity to ask questions using the question box feature, and any technical difficulties, my colleague Elena Chia can help you out. Send an email to fraserbasin@gmail.com, or you can use the question box feature to ask a question as well. So today's speaker is Ting Pan. She's a sustainability coordinator at Island Health. Through presenting relevant regional climate projections, she's raising awareness of climate change's impact on the organization's core mission of providing quality care. And she's leading the efforts to collect information on the impact of extreme weather events that have on infrastructure, patients, and staff in order to understand and prepare for potential negative effects. She continues to work on implementing and integrating climate adaptation assessments into operational and decision-making processes. And Ting previously worked at a local government and a green building consulting firm. She studied mechanical engineering and has a master's degree in resource management and environmental studies from UBC. So before I hand things over to Ting, I'm just going to launch a little poll here to help us see what type of organization you're with. So if you just let us know, that helps Ting customize the information that she's presenting. Okay, so I'm just going to close the poll. Gives us a pretty good sense of who's here. So we've got a pretty good mix of local governments or First Nations, provincial, federal government, some public sector organizations, consultants, and academics and nonprofits. So I'm just going to make Ting the presenter here. Okay.
Okay.
All right.
So can you hear me okay now?
Yeah, we can hear you. Yeah.
Okay. And you can see my screen?
Almost. We're just waiting.
Okay.
There might be a button you need to click to share your screen.
Okay, let me see if there's a button here. I'm not being prompted to click on anything, but I did say that I can see that says no one sees your screen. So
okay. Let's
click
just
start screen sharing.
Start screen sharing. Yeah.
Try that.
Okay.
Yeah.
There we go. Okay.
Yeah, we can see that now.
Yeah, we can see your screen now. So just great.
How about that?
Yes, that looks good.
Yeah.
We can see your screen.
Okay.
Yeah.
Good. Great. Wow. Good morning, everyone. So yeah, great to see that who's in the audience to give me a sense of what you might want to listen. And I guess we're also planning to ask one more question. I just want to get some idea what you want to get out of this webinar, if you have any expectations. I think you can just type your message and then, because I can actually see your comments and Jim will see it and see if there is any emerging themes or patterns, and I'll just read it out very quickly.
That sounds
so
good.
I'll give everybody a few minutes to type. And yeah, I just really want to get an idea what you want to get out of this webinar. I prepared a lot of content, and I really want to make sure that this is a valuable investment of your time, and this will allow me to speak to your needs. So, Tim, do you see any comments?
Not yet, but yeah. So we see a few. Somebody's typed the role of health in climate change and building climate resilience, tangible actions rather than focusing on why health should be engaged in climate change. So one person has suggested.
Okay, great to know. I may skip a few slides at the beginning then.
How Vancouver Island Health is engaging other service providers, e.g. utilities, use of climate models, understanding how climate leadership is being built in the health authority. Any other thoughts here? I mean, while people are typing here, I'm going to just open up a second poll question just before Ting gives her presentation, which also might be useful. Is, are you involved in a planning or design process for a building or a similar capital project in your organization? That's also part of what Ting is able to talk to.
Yeah, I'd like to know if anyone is interested in hearing about the vulnerability assessment of our hospital at all.
Okay, I'm just going to close that and share the results. So it looks like it was quite a few people. Almost 40% of people are saying yes, and another 10% anticipate they will in the future. So about half the folks. So I think that definitely would be of interest.
Okay, great. Well, that's good. Okay. Otherwise, I can skip about 20 slides.
Okay. Well, maybe we'll hand things over to you. But we've got quite a few other suggestions here, which I could
can you
briefly
just,
summarize.
Yeah.
Sharing experiences with other health regions, adaptation models that apply to ecosystem health, interested in the intersection of parks planning, climate change resilience and health, hands-on application, programs, facilities, interjurisdictional coordination, Sustainability and other organizations, regional districts and other agencies.
Hmm.
So somebody that's updating a climate adaptation plan in Saanich, so I'm sure their webinar is going to be useful.
Oh, yeah.
Mental health impacts from climate change.
Right.
MAPP partners working on climate change indicators. Don't know what that means exactly. Interested in how to
Right.
develop resilient strategy for healthcare.
Yeah.
So
Okay. That's a
that's
really quite a
useful for you.
wide-ranging topics.
It is,
I'm
yes.
not sure if I can answer all of them. Yeah, it's great to know.
Okay.
Yeah, so my goal is to provide an overview and perhaps some the flavor of our recent work on climate resiliency. And if any of this is of value to you, then will be aware of this as a resource and explore it further. And if you want more in-depth information I cannot provide, then I can connect you with the right people. And from what I'm hearing is that a lot of people really want to look at some bigger questions and really the practical solutions. And it'll be clear to you, I think, by the end of this presentation that there are a lot of areas that I'm still working towards kind of getting momentum, and you're exactly kind of hitting the areas that I'm really hoping that I will be able to tackle in the near future as well, and I would love to have a conversation about it. But what I'm presenting today is just the work that we have been involved so far. And yeah, so I will start by just going over what I will cover in the next 50 minutes. So first, I will give you a bit of a context of, kind of my current role and the context I'm working within. And then I will move on and talk about the vulnerability assessment of the Nanaimo Regional General Hospital. And that particular project was a big project that just recently got wrapped up, and it has its significance. But I try to stay fairly high level so that, if you want more information, then we can delve into it. But I understand that, may not be relevant to everyone here. And the next two projects are kind of combined. A projection mapping project in the assessment toolkit are something that I'm more involved in, and we had a summer student work with us last summer, so I will touch on those. And then the extreme heat impact survey was something that I just completed very recently, and I will share with you some findings, some preliminary findings, and why we're doing that. And then I know some of you really want to learn more about climate change impacts on health. And I'm not an expert in this area, but I do know the person who has spoken passionately about this and definitely paying attention is one of our medical health officers at Island Health. And I have seen his presentation. I borrowed some slides from him, and hopefully that will give you a sense of, just on that topic, but it's certainly not super in-depth. And it's still an area that we need to develop better understanding of and more work in that area. And I will wrap up the presentation with some of the things that we have on the go or we're planning future. So I hope that I will be able to go through that all in about 45 minutes and still leave enough time for some discussion and questions. So Island Health is one of the 7 health authorities in BC, and we serve about 750,000 people on Vancouver Island, islands in the Salish Sea, and Johnson Strait. And so the map on the right gives you an idea of the geographic coverage areas, and those dots that you see are just where our major facilities are located in. So why did we start Adaptation? It is really helpful that in 2016, the BC's Climate Leadership Plan made it very clear that they call for this 10-year emissions reduction and adaptation plans. We have been thinking about this for a long time, I think, but this really kind of lent some legitimacy to finally allocating resources and time to do this. And we have a 5-year emissions reduction plan, but we don't have an adaptation plan. All the work that we have done so far is really kind of gearing towards eventually developing this plan that is integrated with our emission reduction plan. But a more important reason really for us is, why do we do this and what is our role as a health authority to care about climate adaptation? So we look at this definition from World Health Organization and how they define a climate resilient health system. So it's one that is capable to anticipate, respond to, cope with, recover from, and adapt to climate-related shocks and stress so as to bring sustained improvements in population health despite an unstable climate. So we use that quite a lot, and some of you mentioned, how we cultivate that, leadership support and, to support this kind of work. And we have used that quite a lot in our internal communication because that connects more directly to our core mission, which is to provide quality care. And that is the reason that we should do this. So it doesn't seem like we need to delve too deep into this. I think that, these are just showing the reasons, why there is a strong linkage between climate change and human health, and why should we be involved. So we use this, again, more as a justification for our work when we're communicating with our senior leadership, executives, our facility directors. And this is just one graph that we also use to talk about how climate change have a physical impact and things that we can immediately relate to, things that we can see like a power and water outage, inadequate HVAC systems, building envelope failures. We have some incidents that we can recall that, causes these disruptions. But perhaps less visible, and sometimes we'll make that linkage, but not in a perfect system yet. I mean, we do see that the occasional patient surge in a longer stay, and these are the things that could happen more frequently. But I don't think that we currently in our organization have made a direct linkage that we have this patient surge because this event happens as a result of, climate change. And also on the physical side, we're also trying to tackle this issue of how do we connect climate change with these disruptions and a physical impact. Right now, we could be recording a flooding issue at a site, but there is no indication explanation that particular links to, is this a site that is vulnerable to frequent flooding because, climate change. We're not making that connection, which, makes it very difficult for us to make the case, and that's something that we're trying to work on. And, so as other health authorities, we all recognize that, unless we start to be able to track and understand that actual connections, it's very challenging to build that case and understand the actual impact. So either way, both physical impacts and social impacts will disrupt healthcare service delivery. So that's really linkage to our mission again. And I just want to take a moment to explain the lens through which I look at climate adaptation in my current role. And because my department is situated in the facilities group, so now I'm in the design, energy, and sustainability departments. And we have more influence and perhaps responsibilities on the physical infrastructure. So that's where we start by asking the question, how do we ensure our facilities provide adequate and critical functions in support of a care delivery in this changing climate? But we recognize that, of course, climate change has a broader impact on not just facilities. So next we ask the question, is our organization prepared for climate change, and what can we do to make the organization more resilient? And beyond that is the community, where we need to work with governments and other partners. And so these layers don't really exist in isolation. They interact and they influence each other. And as you can imagine, if there is a health crisis in the community, the organization got affected, and it may increase the load to the facilities, and vice versa. Something that happens to the facilities could have an impact to the organization and to the community. But the other reason I want to bring this up is that it helps maybe explain where we chose to focus so far. And you'll notice later that, for example, we didn't touch on sea level rise very much in our recent work. It is a very important change to consider at the community level, but when we examine the potential impact of sea level rise on our facilities and organization, it is not as significant as other impacts. So in a way, I organize the content of this presentation based on these layers starting from the inner core facilities. So next, oops, click here. So next, I will start by just talking about how we assess vulnerability of our facilities and using this project. So the content of this section was prepared by Joe Chinero, our energy manager, who led the project, and Robert Lapage with RDH Building Science, who is the lead consultant, and then also in collaboration with Trevor Murdoch, climate scientist with Pacific Climate Impact Consortium. And this project started a number of years ago and recently got wrapped up. And before I joined, our team asked the question, how to assess climate vulnerabilities at our facilities? The team looked at different tools, methods, various sites. They landed on the PIEVC protocol, which I will explain in a minute. If you don't know what that is, don't worry. They landed on this protocol because of its rigor, because it's a rigorous process and it's focusing on engineered systems. And then they look at a few different sites, and they're trying to pick sites that are somewhat vulnerable, but also is big and complex enough to test the methodology. It'll give us the confidence to tackle other sites later on, whether it's big or small. And doing it at a big hospital also raises the profile of the study. So NRGH at the Nanaimo Regional General Hospital is the second largest hospital campus. And it also has quite a bit of complexity. We have a range of buildings from different eras, and is also a big energy user. So we're treating this as a pilot project, and the goal is to really learn and build capacity for conducting risk assessments. So first, we started with some work with Trevor directly, and so these next two slides are prepared by Trevor, and I think he might actually be on the call. So we have the advantage of maybe asking him to explain a bit more. I think he can probably come up with 10 points with this slide, but I'm just going to touch on a few key points. So first, just to understand the trend and the variabilities of temperature change, and different scenarios will land us in a very different place. And this is where we could be if we incorporate mitigation and adaptation. But the key things that's interesting to us is when you look at the projection to 2050s, different scenarios really shows very little differences in terms of their range of variabilities and the mean temperature. But still, we're looking at quite a big gap, with what's assumed in BC Building Code. So the second thing I think that we want to share is that Trevor is able to provide us with more detailed climate projections for our area using a procedure called downscaling. And the projections provided plan to adapt, which are available to anyone, by the way. They're at a resolution of 10 kilometers to 10 kilometer by 10 kilometers grid from these large-scale global climate models. And so what Trevor was able to do even further is, using the observed historic data and future projections and drip over this 800-meter grid from past temperature, precipitation information to generate a higher resolution of projected change in the region. So these higher resolution information and map are available. They're generated for the Metro Vancouver areas and the Southern Vancouver Island. I believe that if you want to access it, you just need to get in touch with Trevor through PCIC. And if you want to know more about the climate models, I believe that there is an online course available at the Pacific Institute for Climate Solutions. So PIEVC protocol, so we chose this method. What is it? So PIEVC stands for Public Infrastructure Engineering Vulnerability Committee. It was a committee co-funded by, I believe, Natural Resources Canada and Engineers Canada. And so the committee created this protocol to assess the vulnerabilities of infrastructure to extreme weather events and future changes in climate to enable better planning. So this protocol has been applied across the country, as you can see in the distribution. I think there are more than 40 cases across Canada and also internationally. And it's been used to assess utilities, infrastructure, as well as highways, but it's the first time that it's been applied to a hospital. So here are a few slides shared by, I believe, David Lapp from Engineers Canada when he was trying to explain, what this protocol is trying to do and some key concepts. So I will just touch on those. So how do small changes lead to catastrophic failure? So when you design a facility, you have the design capacity and you have the design load. That's what you anticipate that you will get. The demand is. You build in some safety factor in your capacity. But then over time, that capacity might be reduced because of age or weather. At the same time, you may see a change of use over time that increase the load. And when the severe climate events occurs, that load can be overwhelming and exceeds your capacity. And that's how the system failure happens. And this one shows kind of the change of future climate change and how that mean temperature shifts to a higher temperature and also a wider variability. So you can see this curve is getting kind of more spread out. What this means is that we may get more extreme hot weather and less cold weather, and also the average is moved up. And here is a table that explains the idea of a risk assessment. So the risk level is also determined by two primary factors. One is the consequence or severity, and the other is probability of occurrence. So to help illustrate this, we'll just use an example. So for example, if flooding occurs and it has severe consequence, but it has a low probability, and that's where it's going to end up. So the higher the score, the more severe it is. And the probability is 1, so it's a low probability. But with climate change, we might find that this occurs more frequently. And so that will move this event to an area that has a higher risk score into this red zone. And with a proper adaptation, although we can't really change the weather events and occurrence, we could reduce the risk that as a result of this event. So that's the main idea of how to actually prioritize, what to focus and what measures to take to reduce risk. So the assessment of the Nanaimo Regional General Hospital, so these parts are mostly some perspective from our consultant, working on this project, and it's fairly large, complex building. So this is the kind of aerial view of the hospital campus. It has a large number of different systems. So we assembled a multidisciplinary team to do this work. And so the main concept here is that, we need to figure out what services are needed to ensure each and every room in the hospital can fulfill its clinical function. So I had to break down this large complex building into kind of components, systems and components. So we started off at the high level, looking at the campus, and then we break it down into disciplines. And here we use the kind of a traditional, established disciplines to focus on providing, focusing on providing the basic services required for the hospital space. So, mechanical, structural. So we recognize that there are interactions between the systems, but, when a failure of a service provision, could cause the failure of functionality, regardless how it occurs, it still, traces back to the system. So then in each discipline, we further break it down to the systems and the subsystems and the components. So as I said earlier, so risk is the probability of an event occurring multiplied by consequence. And so the process is to identify patterns, assess vulnerabilities. And we define vulnerability as the load surpassing adaptive capacity. So the emphasis here is the risk is the product of two of these factors. And there are different there are two different methods assessing probability score, as I show here on the right. So method A is more kind of broadly qualitative, and method B is more quantitative. And then this is showing the severity scores and explains, what score 0 means. And so we use that as a guide when we're making decisions and deciding, how severe an event and assessing its impact. And so risk scores. So this gives us the ability to prioritize which systems are at the greatest risk. And so the higher score means greater risk. So now we have probability and we have severity. And the top right corner there is the high risk zone. And for prioritization, anything below 10 was seen as a lower priority. But we had a discussion about it in terms of a risk tolerance of the organization, and that was determined through, sharing and listening the concerns among our staff and determining appropriate risk score tolerance. So probability. So this part was mostly determined by the climate scientists through their interpretation of the climate model data. And we focus on engineering design parameters, looking at these 3 classes of parameters: heat, moisture, and wind. So now we have the probability determined, and then we held a severity workshop. So this is basically a room full of stakeholders and experts in the respective systems. We have consultants, so we have energy managers, we have clinical staff, site administrators, our facility and operation staff. So to work together and identify severity of impact on hospital operations. And it's a voting process. We have to build consensus. Here's an example of how it works. So basically, on the left is the mechanical and the mechanical, and here's the system, and then there's our components. And so so the consultant asked the group, is there interaction between this component, in the event of heat waves? Is there any interactions between this climate variable, which is heat wave, with a fans or cooling coils? So we first put in yes or no. If it's yes, then we start looking at giving a score. So that's from this room full of people from VHA giving the scores. And the consultant didn't show us their own score, so they have to prepare this ahead of time, and they have assigned a score. But in order to not influence our decision, they have hidden the score. But once we have made our score, we'll look at the consultant score. And if there's not a large discrepancy, then we can make a decision. And if there is a large gap, say if we score it to 2 and the consultant score it 7, then that's where the whole team really have to come together and share their perspective and agree and have discussion and agree, where that's going to land. And then now we have the probability score from the scientist. And then after we make the decisions on the severity score, and that will give us the risk score. So that's how we, basically go line by line with each component, looking at all the climate variables and, being able to identify some patterns in the end. So these are the things that we discovered that, heat waves, humidity, and water shortages are the climate variables that are most relevant to this particular site. And, and we are able to identify the most successful systems. And through this exercise and other projects that Trevor was involved in, and we have kind of debriefed, and he really wants to share some best practices how to use climate data. So, he recommends making use of climate information at whatever level of detail available. It is more important to use it now than to wait for better data. Basically, that's the point. And he recommends using a range of future projections. It's mostly because of climate model uncertainties. No one model is perfect, and also, climate itself, that there's variabilities. and some model maybe accounts for certain things better than others. So having that range will more likely to, give you a more realistic expectation and help you plan better. Cross-disciplinary engagement, and that becomes really obvious and key to this study, that, recognizing that we have all gotten accustomed to a certain way of doing things. So we have been building and practicing and maintaining buildings for a long time, and we use, certain rule of thumbs, and we have certain ways of doing things based on a range of assumptions. But now the situation is more complex, and we need to unpack those assumptions, take a step back. We need people in different disciplines, like engineers, architects, to work together and figure out the implications. Iteration. So this is really about, kind of connects to the first point. There is no real answer to what level of details you need in order to build climate resilience. To get more details, it may slow you down. It may take more resources that you may or may not have. So don't let the lack of details stop you from planning. And also using climate projections to inform adaptation strategy is a really dynamic process. Climate models are being improved all the time. More information might be available. And it is wise to revisit what is available every few years and, maybe change our adaptation strategy based on, that information. And here's just a slide from Trevor as well, just to share some resources where you can start. So I'm not going to go over this, and if we distribute the slides, and you can visit some of these links. So just in conclusion, infrastructure adaptation. So what that means, it's kind of different things we learned and the different steps that we took, but really we found it's quite important to first to get some understanding around future climate, and this is a perfect time if you have the resource to engage climate scientists. If not, just use whatever is available to you. Understanding risk and the vulnerabilities. So going back to that the table that shows the severity and the probability, what that really means. And we all have very limited resources, so going through that exercise will help prioritize the risk to deal with the most urgent ones, and then figure out a way to minimize the risk. And once those are dealt with, then we can move down to the less urgent, that's an important task. Evaluate costs and benefits to reduce risk. This is something that we're still trying to get to. So now we have the study done and now know that, which systems are more vulnerable. We still need to build the case and, communicate to people who have the budget to figure out, what is the correct course of action to minimize and reduce that risk. Communicate to decision makers. So, I don't know about your situation, but a lot of times, when we're doing this work, we're not necessarily the one that actually make decisions about, the budgets and, where resources goes. And so it is really important to keep talking to them. And I do think that, choosing a bigger hospital in this case, it is quite an expensive study, but it really catches people's attention because it is a bigger deal. And combining these provide key elements of an infrastructure climate risk assessment and risk mitigation plan. So what we're hoping the next step is, based on the outcome of this study, we'll put in place a risk mitigation plan and connect that to our capital plan and operations, because there are things that we can do on both sides. So there are, probably capital investment that we need, but also there are a lot of things that we could probably also do through maintenance and developing procedures. Not everything, requires a lot of dollars to get started. And also to remember, this is not just for existing infrastructure. And one thing that we continue to collaborate with Trevor on is that, for future buildings and facilities that we're planning, and how to incorporate the climate data into the design of these buildings. I just want to acknowledge that, the vulnerability assessment was partially funded by Natural Resources Canada. The report was recently finished, and I believe that it will be fully available and accessible from Engineer Canada's website. It hasn't been posted yet, but it should be there very shortly. So you can definitely have access to more comprehensive information on this study. All right, I will move on to the next project, which is the projection mapping and adaptation toolkit. So this is where we're still having a focus on facilities that better start to look a little bit beyond. So this project was funded, or the internship actually, who worked on this project was funded by Pacific Institute of Climate Solutions. And we had an excellent intern student from PIEVC, from geography department. The outcome of this project is that we include the maps that now we have with our facilities on them, and we're able to also develop a table with the quantitative climate variables for selected sites, and then we now also have a climate adaptation assessment toolkit that's customized for island health. And we're very fortunate that we're able to build on other people's work. There's some pioneering work done, by these organizations for mapping capital regional districts. Just when we're doing this project, they released their climate projection report. And the Cowichan Valley Regional District has done the same thing. Like they have, commissioned the climate projections with TCIC and made that information available to us, which was just, enormous, because we don't have the resource to actually get that kind of information on our own. And of course, Pacific Climate Impacts Consortium has provided a lot of technical support. And for the assessment tool development, these organizations have developed climate adaptation toolkits, and we reviewed all of them and got really good support from all of them, explaining how they customize their toolkit for their needs, and made it a lot easier for us to identify what we need and how to tailor it. So the projection mapping, so the latest projection that we received and being able to access, there are more variables in the plan to adapt, has higher resolution, and also covering more than half of our island health owner facilities when we look at the geographic coverage areas. We didn't use all the climate variables that are available. We selected 15 that we felt that are most relevant to our facilities. And so we're able to generate some maps, which I will show in the next slide, and also actually put some values that we can share with people who manage specific sites. And that is certainly a very useful tool for engagement and communication. So here is the first set of maps, just showing the historic summer days from 1971 to 2000, and then the projected summer days. And I will just show you that this cross here, that's where the Cowichan District Hospital is currently located, and above it, this is the proposed hospital's location. But if you look at the projected summer days, and you can see that both of them are actually, in this area where we expect to see a lot more summer days. So that's very insightful for people. We're just in the process of planning for this facility, and we now know that, what to anticipate. And so this set of maps I use because it's talking about summer days. Most people can relate to a summer day with temperature greater than 25. And so when I was talking to clinical staff or leadership, and I tend to use this set of variables. And this next set of maps is showing essentially similar information. There's a greater cooling need for these locations. But cooling degree days is really something that, the energy modelers or mechanical engineers will really understand and use. So when we're talking to those people, then we are more likely to use this set of maps. And here is another set of maps looking at a single day maximum precipitation. And you can see that there is an increase of precipitation kind of moving to the Gulf Islands areas and Victoria. So, that tells us that, that's where we should really pay attention to stormwater management perhaps, and, looking at, how our facilities can deal with that maximum precipitation on a single day. And then in terms of the actual values of these variables, so this is one of those 15 climate variables, and I just picked that out as an example, looking at the cooling degree days. So the first column, you look at the past cooling degree days, and you have the projected cooling degree days, and then we just did this kind of quick calculation on the percent change. So it doesn't really matter whether, we shouldn't look at, the percentage change, it's a 700 or 65%, it really doesn't matter. It's really more important to recognize, the direction of the change and the magnitude of change. So we could say, just, in terms of the new Cowichan District Hospital, we're looking at maybe threefold of a change. And then the most severe or the most dramatic increase we're looking at, where you can expect, is probably around the Royal Jubilee Hospital. So really, this is just meant for giving us kind of a sense of the magnitude and a direction of change. And so in terms of the adaptation assessment toolkit, so the toolkit is really a set of questions that you work with the key stakeholders at a particular site. And this toolkit, it was used site-based, and it's used with mostly people who have some control over a particular facility or a campus. And it'll probably take people 2 to 6 hours to respond, depending on how big and complex the site is, related to their roles and responsibilities. And typically we'll have people who manage the site administrator, the clinical lead, and the facility people, and if possible, have the emergency preparedness people being part of this process. And the toolkit covers 5 elements, and to get a score, basically measuring just how prepared you are in any of these elements, and then it gives you an overall score. So the score is not meant to be compared across the site. So if it's 65% for Royal Jubilee and 90% for Nanaimo, it doesn't necessarily mean that Nanaimo is better than Royal Jubilee. Just each site is different. It has its unique situations. It's more meant for tracking the progress that each site has made, and then trying to highlight what needs to be done to kind of future-proof the site. And so we have developed both an Excel and online versions, and we still need to test this with one of our sites, and we're trying to decide which site will be a good case for us to start. And while we're developing this projection mapping and the toolkit, and if you recall, in August and then later on September, we're actually experiencing these the heat waves. And so it dawned on us that this is a really good opportunity to actually gather some information. What people are experiencing, so when this memory is still fresh, because a lot of times when we go out and organize these workshops and go through this assessment toolkit, people have challenges recalling just what the impact was. And also the other limitation was going through that assessment toolkit with a handful of people in the room, was that we're missing out people that may experience impact but couldn't really be there, be part of that group at that particular time and space. So we decided that we're going to try this extreme weather impact surveys, and we pre-developed a set of surveys responding to flooding, extreme heat, and high wind. And we're hoping that when these kind of events occurs, then we will be able to quickly send this out to the areas that are impacted to collect firsthand information. So the intent of having these surveys is to understand the actual impact when that occurs, and to be able to use that data to illustrate the need to prepare for them, and to build a knowledge base in order to formulate appropriate response strategies. So we got 218 responses. Oh, I should also mention that survey is only sent to our staff. We didn't send it to our patients or clients, mainly because we just thought that it might turn into a bigger project that I could handle, and we really just want to have something very quick and be able to gain some insight in a timely manner. So we had over 200 responses from 11 acute care sites, 6 long-term and mental health sites, and 3 health centers. And here it just shows the distribution of the responses. And when we're developing these surveys, and this goes back to that kind of lens that I was looking through, and a mistake that I almost made. And thankfully, Dr. Paul Hasselbach, our medical health director, was able to kind of clear that blind spot for me, was to include people who work in the community and home care. Because I was, when we're looking at it, we're kind of starting from a facilities point of view, and we're only looking at sites that we manage. But there is actually a lot of our professionals and clinical staff don't actually have a physical base, and they work in the community. And it's really important to actually include them because we suspect that they are also being impacted, and the finding did prove that. So I'm really glad that I managed to include that and having that feedback and be able to incorporate that into our survey. Some of the key findings, we find that the cooling capacity is challenged across the board. Whether it doesn't matter how old or how new the buildings, and even if we have cooling or not having cooling, if there's cooling, the capacity was really challenged everywhere. Any support services, a lot of support services workspaces like a laundry room, kitchens, workshops are getting really hot. So it becomes very difficult for those workers to actually keep up. The offices can also be uncomfortably cold or hot, and that points to some issues of the HVAC system is imbalanced. And we definitely, see reports of productivity drop, and safety becomes a concern. If we have staff who work in the workshop that handles, heavy equipment, and they report, being tired and fatigued and having headaches and can't concentrate, that could become a safety concern. Both staff and volunteers suffer. People report that, there's more absentees and volunteers can come to at a regular time. And, especially casual staff, sometimes is just not able to fill the calls. And people in the long-term residential care also notice that the patients become vulnerable. And we certainly see the energy use and the cost increase as well. So I'm going to move on to the last part of the presentation. And this part of the content is prepared by Paul Hasselbach, our medical health officer based in Nanaimo. And recently he gave a presentation. This is just some slides from that presentation. So he highlighted these health-related vulnerabilities due to climate change. First, communicable diseases. So both food and waterborne diseases are expected to rise. Apparently the foodborne communicable disease they fluctuate with seasons, but peak during warm weather. So with prolonged warm weather, we might see an increase in that. Impact of climate change on vector-borne disease. So there are a number of things that could make the situation worse, including expanded geographic range of these pathogen-carrying insects, increased habitats with flooding. You may find these insects in places where you wouldn't have expected before, and they can survive longer in a warmer climate. Air quality. So he shared with us the particulate matter 2.5 levels across Vancouver Island in last August, when we experienced the heat wave as well as the smoke from the forest fire from the interior. And you can see, on average, all that period, we really see a spike and a significant increase. Heat and drought. The most BC expecting an increase in summer temperature and duration. Islands, Fraser and Okanagan valleys expecting precipitation reductions. So combined, that could make very difficult for some people. And human adaptation to heat stress takes about 2 weeks, and during that time is really where people are at the highest risk for heat-related health issues. Food systems. So traditional First Nations food might be under threat. The new climate could allow invasive species to come into the ecosystem and drive out the native species. Quantity production, we may see some species thrive. That could be a benefit or a risk. It's hard to tell sometimes. Animal stresses, livestock and heat, marine mammal water temperature. So the animals are also put under stress during these extreme weather events. Allergens. So when exposed to warmer temperatures and a higher level of CO2, plants grow more vigorously and produce more pollen than they otherwise would, and that could increase allergic reactions and create more health issues with people that already have the asthma. And mold, that is something that will be a concern for buildings that are more frequently flooded, and it's harder to keep the mold out, and people can become allergic to the spores from mold. And also mental well-being. These extreme weather events create a lot of stress and anxieties, creates inequality, and some people might be displaced and become climate refugees. And so, not all people are affected the same way, and we haven't even started tackling any of these issues. So some of the future work we want to do, next steps for island health. So as mentioned, that we are in the stage of identifying a suitable site to test our assessment toolkit. And now we have wrapped up the PIEVC protocol study, and we want to figure out where and when to use this in the future. We started doing some work to ensure new construction and major renovations use climate projections to inform design. So now we have handed over some of these climate projection data that Trevor helped us develop to the mechanical engineers and our energy modelers to run different scenarios and then evaluate different design strategies. Develop staff capacity to identify and implement adaptation measures. So this is more speaking to some projects that I have been trying to get off the ground. And so one thing that I learned through the heat wave impact survey is that, a lot of the residential care facilities don't have air cooling, and it becomes very difficult for them to cope with, and they're there for a long time. And it's not really going to be possible to install cooling all at once everywhere. But there are probably things that staff can do to minimize risk and reduce suffering. So that's something that I am trying to work with our clinical staff to figure out, what can be done. Explore ways to incorporate natural systems on hospital campus, and then that's another area that I'm working with some researchers and my colleagues at other health authorities. And what I'd like to see is recognizing the ability of a natural system to mitigate some of the impact, and not just treating trees as inconvenience obstruction to new construction, but actually recognizing it for both the healing capability and its ability to mitigate climate change. Develop a 10-year adaptation plan integrated with updated mitigation plans. So that's something that we're still working on. So I think that wraps up my presentation, and it's already 12. So Jim, do you think that we still have a few minutes to see if there are any questions?
Well, what I was going to suggest is some people will have to leave, and so what I'm going to do is just put our contact information up. So if people have questions they would like to ask, we can maybe forward those to you. And for those that are able to stay on, we'll we can, if you're able to stay on for another 5 minutes, we can take some more questions. What do you think about that?
Yeah, that sounds
but
good.
I know a number of people have already signed out, so because we're at 12.
Yeah, I'm sorry that it kind of yeah, maxed out our time.
Yeah. So there's one question here from Vincent: is has a smart grid installation been considered with a diesel generator? Stonehenge Farm has a smart microgrid that looks promising for every hospital.
I don't think so, but I'm curious. Yeah, I'd like to know more.
Okay. I also wanted to mention too, a number of people have asked about whether the presentation will be available after. In addition to recording of it, we're planning to put a PDF of the presentation up on our retooling website in the next week or two. Yeah. Another question here from Lewis is: how will study results to date carry forward to a resilient strategy for new facilities? Will seismic resilience be included in renovations and new build?
Sorry, can you just remind us? So there are two questions. So one is for new constructions and the other is for major renovations?
Why don't we just do it one at a time? How will study results to date carry forward to a resilient strategy for new facilities?
Right. A resilient strategy for new constructions. Yeah, we only just started to look at it. I think one of the first things that we did is to make sure that when the new building is built, that we consider these trends. For example, now we're working with the design team to figure out what is the kind of good long-term strategy for mitigating the impact of heat. So traditionally, engineer would just put a bigger cooling system in, but we have to consider now, to do that, it could increase electrical load, and there's also cost implications. So wouldn't it be better to invest in better insulation and just be more, insulated to that change. So it kind of shift that conversation, and that's kind of a starting point. And also, I guess what we're hoping is that, we developed that assessment toolkit. The toolkit traditionally has been used to assess how resilient an existing facility is. But we think that there is no reason why we cannot go through that same kind of process if we know who will be running that hospital and who will be the stakeholders. And so we can do that even before the building is built or is occupied, and identify those areas of vulnerabilities and put them into the operation plans. When the hospital or a care facility opens, then we have those in place. So that's probably what I can think of so far regarding that question.
Yeah. Well, I think to kind of respect everyone's time here, it's 12:05, so I think we will wrap things up. And thank you, Ting, for your very thorough presentation on the different ways that Vancouver Island Health Authority is looking at incorporating future climate and its planning and assessment of existing facilities, as well as the regional mapping and health work that you also talked about. So we really appreciate you taking the time to share your experience. And as I mentioned earlier, if people do have questions that we haven't been able to get to, don't hesitate to contact myself, Jim Vanderwall, or my colleague Elena Chia, and we'd be happy to pass those on to Ting, our speaker. So hope you all have a really great afternoon, and talk to you next time.
Well, thank you for hosting it and for giving me this opportunity.
Okay, bye now.